and welcome to Ask the Oncologist. My name is Dr. Stephen Kpatsi. In this episode, we'll be talking about screening and early detection of prostate cancer. Screening simply means tests that are done or clinical examinations that are undertaken to be able to detect cancer early, to be able to detect cancer before the clinical signs and symptoms begin to show, to be able to detect the cancer before it becomes aggressive and spread to other parts of the body. Now, when it comes to prostate cancer, there are usually two modalities that are involved in the screening of prostate cancer. One is doing the PSA test. PSA stands for prostate specific antigen. And prostate specific antigen is a protein. You can also call it a chemical that is produced by the prostate gland. There are other tissues in the body that do produce the PSA or prostate specific antigen. However, these organs or these tissues produce the PSA in much smaller quantities, so that most of the time when we find an elevation of the PSA in the blood, we can be pretty sure that this elevation is as a result of some problem with the prostate gland. The question is, what causes an elevation in the PSA in the blood of a man? Now, because the PSA is largely produced by the prostate gland, any disturbance of the prostate gland can cause a release of the PSA into the blood, and then it's detected in higher amounts than it will usually have been detected. For example, when a man has a urinary tract infection, he can have his PSA going above the normal values. When the man has an infection of the prostate gland itself, which is not a cancerous condition, it's something we call prostatitis. Prostatitis can result in an elevated PSA, which is also not related to cancer. In fact, medical procedures such as passing a urethral catheter or a digital rectal examination, which is usually conducted by your doctor, can cause an elevation in the PSA in the blood. And all of these conditions are not related to cancer. However, specific to this series, we are focusing on elevated PSAs that are as a result of presence of cancer in the prostate gland. Now, you will understand from all of this that an elevated PSA does not necessarily mean that there is presence of cancer in the prostate. The prostate cancer prevention trial gives us a glimpse into this information. For example, it did find that only 15% or about 15% of men who had a PSA of 4 nanograms per mil or less had some clinical evidence or had pathological evidence of cancer in their prostate at the end of the trial. This percentage increases to about 30 to 35% when the PSA is between 4 nanograms per mil and then 10 nanograms per mil. This figure shoots up to more than 67% when the PSA is higher than 10 nanograms per mil. So you will notice that as the PSA increases higher, the risk or the chances of having cancer in the prostate equally goes up higher as well. Another very common cause of elevated PSA is a condition that we call benign prostatic hyperplasia. So all of this is meant to let you understand that not every elevation in the PSA is as a result of the presence of cancer. However, it is very important not to ignore an elevated PSA anytime you do a test. Another very important screening test that is done to screen for prostate cancer is what we call digital rectal examination. During a digital rectal examination, your doctor will be able to examine the prostate and determine if there's a presence of any nodules in the prostate, suspicious nodules that may increase or that may raise an alarm concerning the presence of cancer in the prostate. The doctor is also able to tell whether there is any changes in the anatomy of the prostate gland, and all of these can be picked up as signs. In fact, there are times where your doctor will be able to tell even when the cancer has spread out of the prostate gland just by doing a digital rectal examination. So this will usually also form part of the screening procedures that you will go through when you decide to have screening for prostate cancer. To answer this question, you first have to ask yourself, what is your risk of developing prostate cancer? Black men and then African Americans have a higher risk of developing prostate cancer. They are also known to tend to have very aggressive disease when it is diagnosed, and most of them tend to have poorer outcomes. So just by being in this category, it means your risk of developing prostate cancer is higher. More so, men who have 1, 2, or 3 first degree relatives who have been diagnosed of prostate cancer have a higher risk of developing prostate cancer. Now, if you have a first degree relative who has any of these cancers, ovarian cancer, who has developed breast cancer at an age younger than 45 years, this increases your risk of developing prostate cancer. And more so, there are certain germline mutations like BRCA1 and 2 mutations. The presence of these genes tend to increase the risk of developing prostate cancer. So if you notice that you have this particular genetic mutation, what it means is that your risk for developing prostate cancer is high. This particular group of people are recommended to start their screening as early as the age 40 years, or at least they have to start discussing with their doctor about screening for prostate cancer from age 40 going. Now, for other individuals who do not have a high risk for developing prostate cancer, it is recommended that from the age 50 years, you can begin to go through screening for prostate cancer. So the frequency at which you will screen for prostate cancer depends on the outcome of the preceding screening test. For example, for somebody who has a slightly abnormal PSA, will require to have a much closer or a much shorter interval follow-up compared to somebody whose PSA is normal for their age. More so, if your digital rectal examination conducted by your doctor is found to have some slightly abnormal signs, for which, however, the biopsy is negative, your screening interval will be shorter compared to somebody whose digital rectal examination was found to be normal. Most people who are at a high risk of developing prostate cancer, it is recommended to do screening at least once in a year, especially from the ages 50 years and above. There are controversies that surround overdiagnosis and overtreatment of prostate cancer, but we'll talk about this in subsequent videos. So stay tuned so that you can get a lot more information concerning that. To end this, I want to remind you that screening helps you to detect the cancer before it spreads, and screening helps you to detect cancer early so that the treatment can be less morbid, and then the outcomes are usually better, and the cost of treatment is usually less when the cancer is detected early. Thank you very much for making time with us. If you liked this video, don't forget to subscribe to the channel. Also like this video and share with other friends and family members and colleagues. And together, we can live a healthy life. Thank you very much, and see you in my next video where I'll be talking about how prostate cancer is diagnosed.